guys, Dr. Brotsky here. Congratulations, you are full term. You're 39 weeks pregnant. That is awesome. You've made it so far. Your baby, if they were born now, would be super healthy, optimal development of the lungs. So this is awesome. This is quite an accomplishment. Things you can be expecting are more irregular contractions, or maybe you're going to go into labor this week. Who knows? You can also notice more and more pressure as your baby drops down lower in your pelvis. It may become more difficult to walk a certain way. You may really find that you have to stop and rest often to get that weight off of your pelvis. This is very, very common. As you're starting to contract more and have more pressure, you also may notice just a little bit of bloody mucus come out, and this is very common. It's called bloody show, and it's associated with your cervix changing. So it's a good sign, but always let your doctor know if you're having any bleeding of any kind. At the doctors, they may also discuss with you an induction, and inductions can be medically indicated, and at this point, at 39 weeks, we sometimes electively induce patients. Elective meaning you're sick of being pregnant and you want to have the baby. So it depends what your cervix is, it depends what your doctors and the hospital's practices are, but that's something to definitely talk to your doctor about. There's also membrane sweeping that's done around this time in pregnancy. It's considered an induction method, but it's more hands-off than anything done in the hospital. It's basically a more aggressive cervical check. So the doctor will insert his or her finger past through the cervix and massage the inside of your cervix to try to help release some local inflammatory cells that can get labor going in the next day or two. It's painful. It's usually associated with some bleeding afterwards. So not every patient wants to have that done, but by this time a good portion of patients are so tired of being pregnant that they want to try it. You do have to be a little bit dilated for a doctor to be able to do this if they're willing to. So discuss those things with your doctor if that's something you're interested in. Things you can do are just things for comfort. Elevate your feet, take frequent breaks, make sure that you're getting plenty of rest, drink lots of fluids. Sometimes walking can help distract you a little bit from the contraction pain, so sometimes people feel better about that. Bouncing on a birthing ball or an exercise ball can also relieve some of the pressure. I tell patients a lot this late in pregnancy as well, get in a swimming pool because it really takes all the weight off of you and can feel so good for the time that you're in it. So that's it for week 39. Hopefully you will have delivered before the next video, but if not, check out my other ones and you can always find me at drbrotsky.com.